Breath of fire, Agni, Pran, Pranyama. Breath of fire is a fundamental pranayama technique used in Kundalini yoga and is a foundational part of many different Kundalini kriyas, exercises. Yogi Bhajan, who brought Kundalini yoga to the West, suggests that people should practice breath of fire until they build up to a continuous 31 minutes to burn away karma and disease, as well as to receive many other health benefits. In general, most people practice breath of fire for rounds of only 1 to 3 minutes. Bhastrika and Kapalabhati are both often incorrectly referred to as breath of fire, even though they use different techniques. The main differences with the breath of fire are the way we breathe, the speed of the respirations, and the amount of air moved per respiration. The inhalation and exhalation are active but gentler and less forced. There is no intense contraction of the core like we see in Bhastrika and Kapalabhati. Instead, the effort of breathing is more balanced between the belly and solar plexus area. The breath is smooth and shallow, approximately 2 to 3 breaths per second. It should feel like you are moving the air from the upper respiratory system rather than deep in the lungs. The power of the breath comes more from the movement of the diaphragm and intercostal muscles and less from the stomach muscles. The belly should remain soft and relaxed during the practice. Each breath should move about the same amount of air, or even a little less than normally breathing, roughly 500 milliliters. There is an audible breath through the nose during the respirations, which should sound smooth, and even on the inhalation and exhalation. Because there is not a focus on the forceful contraction of the core, many people starting this practice do paradoxical breathing, where the belly draws in on the inhalation and out on the exhalation. With breath of fire, we want to maintain healthy breathing habits, allowing the ribs to rise on the inhalation without lifting the shoulders or collarbones, and the belly to expand like we would if we were breathing normally. The stomach should pull in slightly as it follows the movement of the chest. Breath of fire, like the other faster breathing exercises, stimulates the sympathetic nervous system, increases Rajas energy, and decreases carbon dioxide levels in the blood. So, with this breath, we experience most of the energetic and physiological effects that we do with Kapalabhati and Bhastrika. Breath of fire is generally faster than Bhastrika and Kapalabhati, and it takes less effort and is easier to sustain. With breath of fire, we can generally continue the practice longer to create more sympathetic tone, increase stamina, and strengthen our upper respiratory muscles. This breath also moves a lot of physical and emotional energy through the body, which results in emotional release. Some therapists use breathing exercises like this with their patients to stimulate emotional breakthroughs. With any breath practice that focuses on rapid breathing, if we do it long enough, we will eventually breathe off a significant amount of carbon dioxide and begin to feel the hypnocapnic effects, such as increased heart rate, lightheadedness, and dizziness. Overbreathing can cause calcium levels in the blood to drop, which results in tingling or numbness in the hands, feet, face, and belly. It can also cause carpal spasms, where the hands and feet cramp. These sensations are harmless and will resolve themselves after we return to regular breath or after a few breath holds where we increase the CO2 levels. In people who have a history of anxiety and panic disorders, doing any type of rapid breathing can trigger a panic attack. Panic attacks often lead to rapid breathing as a coping mechanism to deal with fear and anxiety. Increasing our respirations is a natural response to the sympathetic nervous system's fight-or-flight response. However, when someone starts to hyperventilate from a panic attack, the effects of overbreathing can make the situation worse. During the attack, it can feel that we are not getting enough air, so we breathe faster, which makes us feel dizzy, lightheaded, confused, and scared. Someone who has experienced this a few times will start to feel the sensations of panic attack coming on from doing rapid breathing exercises. Breath of fire, Bhastrika, and Kapalabhati are mild enough practices that they don't often trigger panic attacks. The fact that these exercises are gentle and controlled enables people with anxiety and panic disorders to learn how to control their anxiety. Since they can initiate the breathing exercise from a calm and relaxed state, control its intensity, and stop the breath, it helps them learn how to manage the breath when a real panic attack comes on and, in some cases, prevents the episode altogether. The faster and deeper the breath is, the more likely it is to trigger a panic attack. Later, I will discuss some open mouth hyperventilation techniques that have a high probability of triggering panic attacks in people who are prone to them. A lot of research has been done on the breathing technique taught by Wim Hof, and this rapid breathing followed by the long kumbhaka holds has been shown to significantly help people who have panic disorders, depression, and other behavioral maladies. Steps to practice breath of fire. Start in a comfortable seated or kneeling position. Rapidly breathe in and out of the nose, 2 to 3 breaths per second. The power of the breath should come from the solar plexus and upper belly area. Keep the stomach soft and relaxed. The breath should be rhythmic and continuous with an equal inhalation and exhalation. Continue for 1 to 3 minutes, repeating for 3 to 5 rounds. Depending on the intent of the practice, it is good to finish with a kumbhaka practice. Breath of fire effects. Decreased CO2, constricted blood vessels, increased blood pressure, increased peripheral perfusion, constricted upper airway. Activates the sympathetic nervous system, mobilization response, increases energy, increases metabolism, decreases digestive functions, increases pain perception. Increases blood alkalinity, increases appetite. Carbon dioxide deficiency enables longer breath retention. Increased rajas energy, focus, and drive. Improved mood and effect.